A second time, and I call the honourable member for Higgins.
Thank you, Mr Deputy Speaker. I rise to speak on the Private Health Insurance Legislation Amendment Age of Dependence Bill 2021. Mr Deputy Speaker, Australia has a two-tiered system of private and public health funding. The private health sector acts both as a complement and substitute for the public system. It is about ensuring we have a great quality safety net for all, but choice and opportunity for those who want it. Australia's private healthcare system is community rated and relies on a mix of consumers with different risk profiles to remain financially viable. However, recently risk profiles have been shifting as young people have opted out of private health insurance. That is why I welcome this legislation. The imbalance that is occurring in the private health insurance industry needs to be addressed to ensure that the private health insurance sector can flourish and continue to offer choice and flexibility for consumers. And that is why the Morrison government is working hard to make sure our nation's private health insurance is simpler and more affordable for younger Australians. As they say, it's about easing the squeeze for private health insurance. And I'm delighted that young people right across Australia and those in my electorate of Higgins will be able to stay on their parents' private health insurance policy for longer with our landmark reforms. That is good news for them, and it's good news for their future. Now, Mr Deputy Speaker, I'd like to provide an example of how this legislation will affect people within my electorate. There is a young constituent, 24-year-old young man who lives in Higgins who has juvenile myoclonic epilepsy, and he recently turned 24. Now, this young man travelled overseas to spend time with his girlfriend in Chile and her family, and he had been waiting for a public listed appointment for his epilepsy. He'd become independent from his family. He was living in a way that wanted to make sure that he was able to do things his way, and he was waiting for a public listed appointment. He had a fit when he was overseas in Chile, and was quite a serious fit, quite life-threatening, and then came home to Australia realising that his private health insurance had lapsed and he was unable to get an appointment. So he'd been waiting for a long period of time in the public health system. And what this young man had done was not continue his private health insurance. And that is because he had just commenced work, he'd finished university, he was in the first year of his job, and it wasn't one of his financial priorities. And that's very understandable for young people. When they first get their job, that first job is very, very important to them, and every penny counts. And this young man decided that private health insurance wasn't a priority for him, but as a result he'd waited longer than was necessary. He ended up not getting the medication adjustment that was needed, and he developed a fit. That young man happened to be my son, Monty Allen. And so I was very delighted to see that this legislation would be applying to him, where at the age of 24 he'd be able to be brought under my family health in private health insurance until the age of 31. And as a mother, that gives me cause for comfort that he will be able to continue to have private health insurance, continue to have choice and opportunity, and access a quicker appointment to make sure that his epilepsy is kept under control. Now, Mr Deputy Speaker, we also know that research shows that individuals who have been introduced to private health insurance have a higher likelihood of renewing their insurance in the future. And that's exactly what I'm hopeful, that Monty will get used to having his private health insurance, enjoy the benefits that come with private health insurance, and when he gets to the age of 31 is no longer required or can no longer be under our cover, our family cover for private health insurance, he will be at the age when he wishes to invest in his own health future through private health insurance. So it is likely that young adults, now that we've had these sensible and reasonable changes to our legislation, that young adults are more likely to take out insurance after making use of it on a family plan. It's at a time of their lives when they're starting to look to starting their own family and taking on the private health responsibilities that they may like to have for their partner, whoever that may be, and their children if they are to have them. As a member in this place, representing a vibrant younger electorate, and as a mother of 4 young adults, I know how important reforms to ensuring a successful private health insurance system are. We on this side of the House are firmly committed to strengthening and simplifying private health insurance and making it more accessible. We understand that we have a very unique health and education system here in Australia, one that benefits from the private-public complement, from the private-public balance, whether it's health or education. We take the best from the European system, which is more socialised, and the best from the private system in the US, and we have a very good system which provides a good, high-level quality baseline of health and education, but with choice and options for those who wish to pay more for flexibility and accessibility for their insurance with health or whether it's in education. Mr Deputy Speaker, under the reforms proposed in this bill, the maximum age of dependency for private health insurance policies will be increased from 24 to 31 years of age. It's a very practical measure to help and support the private health insurance sector. This means that young adults will be able to stay on their parents' private health insurance policy for longer, when many young adults may consider opting out of private health insurance altogether. For the first time, there will also be an opportunity for insurers to offer policies with no age limit for dependents with a disability. Again, simplifying and making the system fairer, Mr Deputy Speaker. I will say, as a paediatrician, over and over again, we would hear about those who have got chronic health conditions and disabilities in the paediatric sector, moving to the adult sector, and the difficulty it is for them moving into a sector which doesn't see them in the same way that the paediatric sector sees them. So it is really very, very encouraging that this change to our legislation is being proposed, because particularly young children with a disability going into adults, it's very important that they continue to have the support, as they are often still dependent on their family and their parents for that support. People with a disability can be confident that they will be provided with the opportunity to access more affordable private health insurance without age limits, as they can be covered under family policy at a lower cost rather than purchase a stand-alone policy. And I think both sides of the House should welcome this change to our policy and our legislation, because it helps those who need the help the most. Further to that, Mr Deputy Speaker, we've also simplified the definition of a person living with a disability for the purpose of private health insurance, as any person who is a participant in the NDIS. So we're bringing in line the definition of the NDIS from the point of view of disability for the definition of PHI, and that's been welcomed by the insurers and the sectors. Private health insurers, however, will have the flexibility to go beyond this to offer coverage to those who do not meet NDIS eligibility requirements. So it will provide the opportunity for those PHI who want to step up and support the disability sector to do just that. Mr Deputy Speaker, while this reform benefits primarily younger Australians who can remain on their parents' insurance policy for longer, it will also contribute to making our private health insurance more sustainable in the longer term by helping the transition of more young people to their own adult cover when they turn 31 years of age. So this is good for the sector, it's good for the stability of the sector, and it's good for the long-term viability of the sector. Mr Deputy Speaker, this bill reflects the Morrison government's ongoing reforms to private health insurance to ensure it is more affordable, more accessible and more attractive to all Australians. Acting on our commitments, these reforms have delivered the lowest annual average industry price change for consumers in 2 decades. At just 2.74%, this figure is over 50% lower than the premium rises under the previous Labor government. Young people particularly stand to benefit, with 425,000 people aged 18 to 29 receiving discounts of up to 10% on their premiums since April 1, 2019, when those measures were introduced. With the Morrison government committed to improving private health insurance for all Australians, more than 13.7 million Australians now have bought policies, receiving a record $21.9 billion in benefits for medical services through the private health system. So the private health system, Mr Deputy Speaker, really is doing some significant heavy lifting from the financial side of things with regards to our healthcare system. So they're a very important partnered part of the system, the public system and the private system. The private does do a lot of heavy lifting with regards to service provision for Australians. Further, as a doctor, I'm passionate as an advocate for better health outcomes, which is why I'm particularly proud that this reform will further assist in the access of mental health services for young people. Almost half the population, that's 45%, aged between the ages of 16 and 85 years of age, will experience some form of mental health difficulty in their lifetime. I don't think that's a surprise to anyone in this House. I'm sure that's not a surprise to anyone listening to this speech. We know mental health issues are on the rise, they're more recognised, they're more concerning, and we need to do more to support people who need to access the services both at a preventative capacity but also at a treatment capacity. Typically, onset is around mid to late adolescence, with young people having the highest prevalence of any age group. So we need to do more to help our young and that is why I'm very pleased that in these darkest moments we must ensure access to vital psychiatric services, particularly as our younger generations have faced the challenges that the COVID pandemic have delivered. Supporting young people around Australia and their mental health is a priority for the Morrison government, and instrumental to this plan is lowering the cost of private health insurance for young Australians so they can use that in that way. The government's reforms to private health insurance are improving access to medical services for young people, including mental health services. And that is a good reason in itself to continue to support your own private health insurance if you have indeed been part of a family private health insurance plan. This is in conjunction with our commitment as a government to $509 million towards the Youth Mental Health and Suicide Prevention Plan, the most substantial strategy of its kind in Australian history. Mr Deputy Speaker, we recognise the difficulties Australians face with regards to mental health, and we have Australians back when it comes to delivering services for mental health. Mr Deputy Speaker, the coronavirus pandemic has shown us all the importance of a world-class health system. Indeed, Mr Deputy Speaker, Australia's health system continues to be one of the best in the world, and I think Australians knew that before the COVID pandemic, but now they are certain of it. And that is because we can see in our public health response and in our health delivery, whether it comes to PPE provision, COVID testing and now the COVID vaccine rollout, that the Australian healthcare system has what it takes to deliver great outcomes for all Australians. And the private health insurance system is a very important part of that sector. The Australian government's long-standing and robust relationship with the private health insurance sector ensures that these resources can be mustered in the response to the COVID pandemic. And I know that in Victoria in particular, there was a very good arrangement made between the private healthcare system and the public healthcare system, where both systems worked together in tandem to increase the capability of our intensive care beds from 2,200 of tripling to 7,500 in preparation for what never eventuated, in preparation for what was going to be if we didn't take the actions that we took to close our borders internationally and activate quarantine and contact tracing. If those hadn't have worked, then we would have a very rapid rise in our intensive care beds, and the private and public healthcare sector worked hand in glove, along with the National Cabinet and the work between the federal government and the Victorian state government, to ensure that we could triple our ICU capacity in the event of a pandemic spiralling out of control here in Australia, and thank goodness that was not required. But there was preparedness in the system that was to be celebrated, but there was also preparedness to work together across the private and public health sector and across the state and federal health divisions. So I think that we can all feel very grateful as Australians that there was a recognition that COVID was providing us with very unique challenges, but that Australia had a very unique response, a very good response, a par excellence response to the pandemic as it was emerging around the globe, and that Australia responded in a very swift, a very effective and a very appropriate way with regards to both the dual health and economic issues that faced our country. And we did this together as a country. Continued investment by the Morrison government in private health insurance, with over $6.3 billion via the private health insurance rebate, proves our commitment to affordable and flexible options for all Australians when choosing private health insurance. Mr Deputy Speaker, this bill reflects the hard work of the Morrison government to ensure the improvement of our private health system is an accessible, affordable and a fair system for all Australians. I commend this motion to the House. Thank you, Mr Deputy Speaker.
The question